Welcome to Health Diagnosis, your trusted global platform for reliable medical knowledge and health awareness. Today's topic carries a United States health alert, because obesity has become one of the most serious public health challenges across the country. This discussion will take you deep into what obesity really is, why it happens, how it affects the human body, how it can be prevented and treated, and why every American should take this condition seriously. Obesity is not just about body weight or appearance. It is a complex chronic disease involving excessive accumulation of body fat that can impair health. When the amount of stored fat in the body becomes too high, it starts affecting the functioning of organs, hormones, and metabolism. The most common measure to define obesity is the body mass index, or BMI. A BMI between 18.5 and 24.9 is considered normal, 25 to 29.9 is overweight, and 30 or above is classified as obese. However, BMI alone doesn't always tell the full story, because muscle mass and fat distribution also matter. In the United States, obesity rates have reached epidemic levels. According to the CDC, over 42% of American adults are obese, and about 20% of children and adolescents fall into the same category. This rise has been steady over the last few decades, fueled by lifestyle changes, easy access to high-calorie processed foods, sedentary habits, and increased stress. Obesity is now one of the leading causes of preventable death in America, linked to heart disease, diabetes, certain cancers, and stroke. The modern American lifestyle plays a major role. Fast food is cheap, quick, and widely available. Sugar-sweetened beverages are a part of daily life for millions. Many jobs involve sitting for long hours, and leisure time is often spent in front of screens. Even though gyms and fitness centers are common, the majority of people struggle to maintain regular exercise routines due to time constraints, motivation issues, or physical limitations. This imbalance between calorie intake and energy expenditure leads to weight gain over time. Genetics also influence obesity. Some people have a genetic predisposition that makes it easier for them to gain weight and harder to lose it. However, genes alone don't explain the current obesity crisis. It's the interaction between genes, environment, and behavior that determines how the body stores and burns fat. Hormones such as leptin, insulin, ghrelin, and cortisol play a big role. When these hormones become unbalanced due to poor diet, lack of sleep, or chronic stress, appetite control and fat storage become disrupted. Obesity isn't just a physical condition, it affects mental and emotional health deeply. Many people who struggle with weight experience low self-esteem, anxiety, and depression. In the United States, weight stigma and body shaming remain common, especially on social media. This emotional burden can lead to emotional eating, using food as comfort, which further worsens the condition. It becomes a cycle that's hard to break without support. Health complications of obesity are severe and wide-ranging. It increases the risk of type 2 diabetes, heart disease, hypertension, stroke, sleep apnea, osteoarthritis, fatty liver disease, and even some cancers such as breast, colon, and pancreatic cancer. It also affects fertility in both men and women and complicates pregnancy. The extra weight puts strain on the joints, especially the knees and spine, leading to chronic pain. Many obese individuals also suffer from fatigue, shortness of breath, and reduced physical stamina. From an economic standpoint, obesity costs the United States more than $170 billion annually in healthcare expenses. Employers also face challenges due to absenteeism, lower productivity, and higher insurance costs. These numbers highlight that obesity is not just an individual problem, it's a national concern affecting the economy, healthcare system, and quality of life for millions. One of the key drivers of obesity in America is the overconsumption of ultra-processed foods rich in sugar, salt, and unhealthy fats. Items like fast food burgers, fries, pizza, soda, and packaged snacks are extremely calorie-dense but nutrient-poor. They trigger dopamine release in the brain, creating a pleasurable sensation that encourages overeating. Portion sizes in the U.S. are also much larger than in most other countries, meaning people often consume more calories than they realize. Reducing sugar intake is one of the simplest yet most effective steps toward weight control. Sugar-sweetened drinks such as sodas, energy drinks, and even fruit juices are among the largest sources of added sugar in the American diet. Replacing them with water, unsweetened tea, or sparkling water can make a noticeable difference. Similarly, increasing protein intake helps keep hunger at bay and maintains muscle mass during weight loss. Whole foods like vegetables, fruits, lean meats, eggs, beans, and nuts are far healthier choices than processed alternatives. Regular physical activity is another essential component of obesity prevention. The CDC recommends at least 150 minutes of moderate-intensity exercise per week, such as brisk walking, cycling, or swimming, combined with 2 sessions of strength training. However, in the United States, about 75% of adults fail to meet these activity guidelines. Sedentary lifestyles, long hours sitting in offices, cars, or watching television have become the norm. Even small changes like taking the stairs, walking during phone calls, or using standing desks can contribute to calorie expenditure. Sleep plays a hidden but powerful role in weight management. Studies show that people who sleep less than 6 hours per night have higher levels of ghrelin, the hunger hormone, and lower levels of leptin, which signals fullness. This leads to increased appetite and cravings for high-calorie foods. Therefore, maintaining a consistent sleep schedule of 7 to 8 hours per night is essential for a healthy metabolism. Stress also affects weight. When under stress, the body releases cortisol, a hormone that increases appetite and promotes fat storage, especially around the abdomen. In the fast-paced environment of the United States, where work pressure, financial struggles, and digital overload are common, chronic stress contributes significantly to obesity. Mindfulness practices, yoga, deep breathing, and regular breaks from screens can help manage stress and support better weight control. Treating obesity requires a comprehensive approach rather than a quick fix. Crash diets, weight loss pills, and extreme fasting often produce temporary results but rarely sustain long-term success. The most effective strategy combines balanced nutrition, consistent physical activity, behavioral therapy, and medical support when necessary. For severely obese individuals, medical interventions such as prescription medications or bariatric surgery may be considered under medical supervision. Behavioral therapy focuses on changing the habits that contribute to overeating. Identifying triggers like boredom, loneliness, or stress helps people develop healthier coping mechanisms. Tracking food intake through apps, planning meals ahead of time, and setting realistic goals are practical tools that encourage accountability. Social support from friends, family, or support groups increases motivation and reduces the feeling of isolation. Public health policies also play a major role in combating obesity. In the United States, several states have introduced taxes on sugary drinks, labeling requirements for fast food menus, and programs promoting physical activity in schools. However, more work is needed to ensure healthy food options are affordable and accessible to everyone, especially in low-income neighborhoods where fast food outlets often outnumber grocery stores. Technology has both helped and hurt the obesity crisis. While digital fitness trackers and apps encourage physical activity, excessive screen time from phones, computers, and television promotes sedentary behavior. Finding a balance using technology as a tool for health rather than a distraction is crucial. Apps that track steps, calories, and sleep can help users stay aware of their lifestyle patterns and make informed adjustments. Children's obesity is one of the most concerning aspects in the United States today. Many children consume fast food regularly, spend hours on video games or social media, and rarely engage in outdoor play. Childhood obesity increases the risk of diabetes, heart problems, and emotional distress at a young age. Parents can play a vital role by modeling healthy habits, preparing home-cooked meals, limiting screen time, and encouraging sports and active hobbies. For adults, especially those working full-time, finding time to exercise or cook healthy meals can be challenging. But small, consistent efforts matter. Choosing water over a soda, walking during lunch breaks, avoiding late-night snacks, and ensuring portion control all add up over time. Remember, progress doesn't require perfection, it requires persistence. The emotional aspect of obesity is often underestimated. Many Americans live under immense pressure from society's beauty standards. It's important to understand that weight loss should never be about punishment or shame. It should be about improving health, energy, and confidence. Self-compassion and a positive mindset are key to sustainable change. Obesity can be reversed. Countless success stories across the United States show that with discipline, guidance, and consistency, individuals have transformed their lives. Even a modest weight loss of 5% to 10% can dramatically reduce the risk of chronic diseases and improve overall quality of life. The goal should always be to create habits that are sustainable and not to chase quick, temporary results. On a national scale, awareness and education are vital. Schools, workplaces, and communities need to promote physical wellness through nutrition education, outdoor activities, and mental health support. If every American made small, meaningful lifestyle changes, the nation's obesity rate could begin to decline within a generation. As we reach the end of this topic, remember this: obesity is not a failure, it's a signal. It's your body asking for balance, attention, and care. Every meal, every step, and every healthy choice you make matters. Whether you live in New York, Texas, California, or anywhere across the United States, the journey toward better health begins with awareness and action. Thank you for watching Health Diagnosis. If you found this message helpful, don't forget to like, share, and subscribe for more science-based health information. Stay motivated, stay active, and take charge of your health, because your body deserves your attention, and your future depends on it.